And this event today is co-hosted by SEI-Type and Stockholm Environment Institute York, SEI-York, and our chair today is from the Stockholm Environment Institute Global Foundation. And this event resonates perfectly with the missions of all three co-hosts, really. SEI's mission is to facilitate and deliver world-class interdisciplinary research on environmental sustainability for the research community, industry and policymakers, and a core part of their mission is to strengthen links between researchers and policymakers. TYPE is designed to support collaboration between York academics as experts in their respective fields and policy colleagues locally, nationally and internationally. So they offer resources for academics to engage with policymakers. And SEI, we are an independent international research institute which specialises in environment and development and research. And the institute has been around for over 30 years now. York's research is geared towards translating scientific evidence into information from which sound policy can be developed and through which we can change behaviour. So I'm really pleased to introduce Rob Watt, who is Head of Strategic Engagement at the Stockholm Environment Institute, Global Head of Strategic Engagement, and he will be chairing today's webinar. Just before we move to Rob and the panelists, a bit of webinar format information. So basically, the discussion will be a panel and Q&A session formats. And the panelists will be invited by the chair to briefly introduce themselves and their work experience of engaging with global policy. We have had some pre-submitted Q&A questions, which we will run through today, but also you're welcome to put questions into the Q&A part of, if you click Q&A at the bottom of the Zoom link. If you could use that primarily, that would be great, but I think the chat is also available. So after that, we will hopefully have a lively Q&A session. And also I must say thanks to Jane Goulet from SEI, who's facilitated this webinar and is dealing with the technical side today. So our chair today, as I introduced him, is Rob Watt, Head of Global Strategic Engagement at SEI. And I'm really pleased to pass over to Rob to chair today's session.
Thank you so much, Anwen, and it's a real pleasure to be part of this fantastic event. And I'm going to just briefly say something about the panel as a whole before asking each individual panelist to introduce themselves and talk a little bit about their work and their experience and how they relate in their work and with the work they do in their organisation to science and policy. But I think it's a really exciting panel that we have that really will give us the opportunity to explore a lot of different issues around engaging with policy in a global context. We've got people who are working in Asia, who have worked extensively in Africa. So we've got really different and a widespread of different regional experience. We've got people who are working and have engaged with policymakers at a very international level, at UN panels and those sorts of things. And we have others that are really engaged in sort of more community levels. It's an urban scale. So we have different regions, we have different scales, and then we also have a fantastic range of different experiences and sort of journeys in how they have now working to bring their science and bring it to bear on policy and practice, and that is bringing it to bear both in a national and local and a global context. But we have such a wonderful diverse panel for you today to explore these things, and I'm going to ask Dr. Razia Fatima to start us off with a brief presentation of what her work is and how it relates to policy. Because Razia, you're working in Pakistan, if I'm right about that, and you're the head of, you're the chief of research and surveillance at the Common Management Unit in Pakistan. Tell us a little bit more about that unit and your work there.
Thank you so much, Robert, for giving me an opportunity to speak here. I'm affiliated with this institution for last 14 years, and I'm looking after research and surveillance, which is main domain for me. I'm basically epidemiologist, And I have been working on research in the past, focusing mainly on tuberculosis, but also because it's a common unit now. So HIV and malaria are also our areas for research for last 3-4 years. So looking at at the policy level interaction, I think this is the most important part of my job, because I'm affiliated with the Ministry of Health. So we have to engage and we have to convince policymakers frequently, about our work, and especially on the research. So I've published many papers, like 58 research papers in international peer-reviewed journals, and all are linked with some positive policy changes, which is requirement from our unit as well. So whatever research we do, we have to link it with the policy impact. So the best example I can give you was our work with the University of York consortium on TB and tobacco. So it was a long trial for 4 years, and then we worked together as a team. And then we had to update our, of course, the managers and the policymakers, and we had to plan a dissemination for them. And after that, it was, greatly appreciated, and the results were actually presented to the ministry and to the program. So, and one of the province actually adopted that to scale up, and to implement it as a case study. So the simple questions were added in the data collection tool, and then trainings were imparted. They were very useful, for whole province, and it actually proved that these simple interventions can help us quit smoking and improve the treatment outcomes in terms of, for the program. So this is already published, and we have all this evidence available. And likewise, recently we have also, because I'm also vice chair at the union TB section for the union against TB and lung disease. So we had an opportunity to discuss that we should have another subgroup under the TB section. So we should have this on TB and multimorbidity. So thanks to Helen and Dr. Kamran and Dr. Najma, so to lead this. And now we are having this separately as a group, as a subgroup in the TB section. So now everybody who is interested to join, they can join. So this would influence not only our country policy, but also at the global level. So I think for these long years journey, we have learned a lot to interact with the global partners and with the national stakeholders and even the regional to work best for the policy changes in the country.
Thank you so much, Razia, for that introduction to your work, both at that national context, the research that you've done, and the evidence you present, but also linking that to the more international context and the work where with the union, and how those two interact may be something that we want to come back to in the future. I'm now going to turn to our next panelist, Dr. Sushil Baral, who is the Managing Director of HERDI, based in Nepal. And again, we have a really interesting perspective here of someone who is working in an organization that, again, perhaps has a connection to national level policy making, but obviously has firm foundations in science. So Sushil, please tell us a little bit about the work you do and how you're relating that to policy. Thank you.
Thank you, Rob. Very nice. Welcome, everyone. This is me, Sushil Baral from Nepal, a mountain country. I mean, Nepal is known as a mountainous country, but we do have flat area as well, and mid-hill and mountain as well. Okay, very welcome to you all. I'm Sushil Baral. I work for an organization called Health International, which is the national research organization working very closely with the government counterparts, especially with the Ministry of Health and Population. I started my journey in health as a paramedic working in a village, remote area in mountain district of Nepal. That was my first interaction with the health sector. I didn't know what the policy means at that point of time when I was actually engaged in delivering services to the community people, engaging community members in terms of uplifting their lives through the public health messages. And then I gradually worked in the provincial level, at that time of Nepal's government structure, a regional level. I worked as a regional tuberculosis and leprosy supervisor, which gave me an opportunity to understand how the policy is being communicated. Even I didn't know actually how the policies are formed. And I came to know how the policies are being communicated across the different layers of the government and how do we implement that. Then fortunately, I moved to the national level, started working with Ministry of Health and Population under the name of HERD, which is the organization primarily generating evidence and influencing the policy. And then I started working with the infectious disease control program. Then I came to know that how the policies are being formed. And that experience I actually gathered together with the other colleagues. And now I have been working as a strategic advisor to Ministry of Health and Population on the policy and planning. That my work is more on relating the generating evidence and how do we transfer the evidence into policy and actions, not only the policy to the actions. So we are very much embedded with the Ministry of Health and Population with a number of research, for example, the chorus, which we have been working for a long time in urban health systems, understanding how the urban health system has been progressing over the years, and also the communicable diseases and NCDs. So I'm very glad to be here today to talk about the journey, how we engage in policymaking processes and my experience over you. Over to you, Rob. Thank you very much.
Thanks so much, Sushil. A really interesting journey that you've had and traced out for us there. And I'm sure we'd love to come back to hear a little bit more of your insights around policy communication as well. What's worked? What surprised you when you first became exposed to that? But now it's time to move across to our next panelist, and that is Professor Romano Hook. And we're moving to Bangladesh. The professor is executive director of the ARC Foundation, and also we're now moving again from the sort of the national context connected with national policy making to an NGO committed to socioeconomic development in Bangladesh and using evidence to support that development. Please, really looking forward to hearing from you, Romano, about how you are working and how your organization is working to bridge science and policy.
Thank you, and thank you for inviting me in this session. I am Romano Hook from Bangladesh. I am a health economist by training. I started my career as a lecturer in University of Dhaka. When I started working in the health sector, I realized that there is a gap between the evidence and also how to translate the research into policy and practice. And when I started publishing papers, I saw that there is no audience other than the academician, and it is not reaching to the policymakers. So then I thought that it's really important to embed the research within the system. And I started working in ARC Foundation, which is a research NGO. And I tried to bridge the gap between the academicians and the policymakers. At ARC Foundation, we do research on health system strengthening, including the urban health, a non-communicable disease control program, including mental health and tobacco control, and also antimicrobial resistance control in Bangladesh. And through this research, we tried to generate evidence, but then I thought that, okay, how to translate that, how to communicate that, which I started, from the very beginning of my career, that how to link with the policymakers. And then I thought that there are two ways to do it, that in my research, I include them at every stage so that they know that what I'm doing. And then when the research is completed, they own the findings of the research, and they then use that into their policymaking process. And also I thought that I should be in the other side of the table, that I have to be in the different committees or different policymaking process so that I can also contribute from the other side of the table. So I started working with the government very closely. One is the planning wing of the Ministry of Health and Family Welfare, where I work with the policymakers to develop the health sector programs. I was contributing in developing the fourth health sector program, strategic investment plan, annual program review. So that gave me the opportunity to know and understand the policy making process and the language of the policymakers, and how I can translate my research into their language so that they can use that and try to bridge that gap. So now in ARC Foundation, we do need-based research. So we try to find out that where are the gaps where government really is looking for evidence, and then we engage them, as I was saying, at different stages so that they own the research, and they also guide us in identifying the research questions and even guiding in developing the methodology and validating them and disseminating. So through this entire embedded process, I think now I'm trying to contribute at the national level in the policy making, and now I'm receiving the request from the government to support them to do the mental health investment case and some urban health strategic costed action plan. So now I'm in a position with ARC Foundation that to engage further with the government, both way, engaging them in my research and also engaging in the policy making process. I'll stop there, and thank you once again.
Thank you so much, Romano. A wonderful insight into, again, how the evidence can be brought to bear upon and really inform policy making and different pathways and contexts that you need to engage with. I'm sure we'll unpack some of those and hear different examples. And we're now going to turn to a new panelist and a different set of examples, Professor Paul Revel, who is from the Centre for Health Economics, and he's the lead for Global Health Economic Evaluation, but also developer, he's the director of Tanzi Laonze, which is an initiative, a project working in Malawi and Uganda. Paul, really looking forward to hearing about your experience and the work that you're doing and how it's relevant to this influence on policies.
Thank you, Rob, and thanks also to Jane and Anwen for the invite to speak. So, as you've mentioned, I currently direct a program here at the Centre for Health Economics, which is all about developing research methods with the express purpose of informing policy. And we see our value of the research that we undertake in terms of its potential to better inform policy, with the ultimate goal of improving population health in the countries within which we work. My background into the world of policy and then shaping research projects aimed at meeting policy needs really began when I finished an MSc a number of years ago, too many years ago now, here in York. And I was fortunate to receive a fellowship offer, which enabled me to work for the Ministry of Health in Malawi for 2 years. And it was really during that time that I gained an appreciation of the ethos that underpins civil service and gained an affinity and a sense of solidarity with many of the people doing tasks which Razia, Romano and Sushil have described in needing to make decisions, often with limited evidence and under sometimes quite severe pressures. In Malawi at that time, the colleagues who I was working with hand in hand were responsible for allocating the whole of Malawi's health budget, which only amounted to $3.70 per person. So you can see the challenges that they faced. From then, I returned to York, which was the start of my research career. And the central purpose was health economic methods, which could aid just the types of individuals who I've been working with. Initially, that focused at the national level, developing things such as methods to choose priority interventions or allocate healthcare budgets across districts. But in aid-dependent countries such as Malawi, you soon start to realise that the choice set that faces national policymakers when such a large proportion of funding comes from external sources and there are additional influences which reside internationally is dependent upon the actions of international policymakers. So my research developed in a way whereby initially I kind of quite heavily critiqued some of the approaches by international organisations such as the World Health Organization or UNAIDS, in that they were making decisions which didn't really align with the priorities of countries such as Malawi. And I guess that drew me into the area of international level research to policy discussions. Initially probably been slightly thorn in the side to some of the international policymakers, but through time building trust and understanding, recognising that all people at all levels really ultimately have the same objectives, which is that for their work to lead to beneficial impacts for populations. And we've been on a bit of a journey, I guess, in trying to think about how health economic methods can better guide actions of international policymakers. Basically, bottom line is to ensure that the first priorities are met first, and don't try to push too many different agendas on systems which can't deliver everything fully. You know, where priorities need to be made and set. So thank you. That's all for now.
Thanks so much, Paul. Really interesting, and I'm rather looking forward to talking a little bit more about being a thorn in the side, perhaps, as well as being the ones presenting evidence that can be used by policy, perhaps also challenging some assumptions, speaking a bit of truth to power. That'll be a really interesting perspective to hear how you brave that task as a researcher. Now to turn to our next panelist, Dr. Helen Elsie, who is an Associate Professor of Global Public Health in the Department of Health Sciences and the Interdisciplinary Global Development Centre. That is a mouthful, but fortunately on Twitter, Helen has one of the shortest Twitter bios I've ever seen. It simply says researcher working on global public health, and that's enough for everybody to know. So perhaps you can tell us a little bit more about yourself, Helen, and about the work that you do.
Thanks, Rob. Yeah, and I've been really lucky to work with Razia, Romano and Sushil on a number of projects, and particularly Razia has mentioned the TB and Tobacco project, which we were all able to work together and really working with national TB programs and national governments to try to influence policy and practice. And I think the insights from that program, I'm sure we'll be able to sort of feed those in a little bit into the discussions, but I think really interesting in terms of understanding how to really focus on what health systems changes were really needed to bring about changes to practice, and keeping it really focused and really simple and really achievable for those NTP, those national TB programs. And I think what I've learned from working with all through Sushil, Romano and Razia is just the need for that continual engagement with policymakers and decision makers, and building those relationships and understanding from their perspective about how you can make change. And I think as a researcher and a public health researcher, you know, you can get so focused on your research and the methods, and it's all so interesting. But I think boiling it down into the key changes that you can make within health systems, keeping it simple so that these things can actually be implemented, it has been such a lesson. And then the other work that I'm doing, Sushil mentioned the Chorus research program. So the focus here is really on urban health and trying to influence and improve urban health systems in West Africa and in South Asia. And I think one thing we're trying to do there, and I'm not saying that we have many kind of real success stories yet because we're just beginning, but is really looking at how you can influence policy and practice from the bottom up. So working very much with communities, supporting them to generate the issues and advocate and change. So you're kind of coming at it from both directions. So I think some really interesting ways of working, and I know that the experiences that that particularly ARC and also Herd International have had in terms of engaging with communities and working with decision makers at all levels, whether it's local governments, local health providers, and community groups and activists, and kind of, you know, not doing all the work yourself, but developing those allies to really make change. So yeah, I'm really interested to hear the rest of the discussion.
Thank you so much, Helen. Thank you also for opening up a load of other interesting perspectives for us, and about, you know, are there differences in how you develop relationships or engage with policy depending on the levels at which you're engaging, and how do you build alliances to really accelerate the change in policy, but also the implementation, the actual practical change on the ground. Really interesting. Let's make sure that we don't lose sight of that in our conversation. But before we get into a bit more of a freer conversation, I'm going to hand over to our final panelist, who is a close colleague and a good friend, Dr. Johan Schillerfranna from SEI-York, also, of course, based at the University of York. I'm going to say something about Johan because he's a terribly modest person. But Johan, of course, has done a huge amount of incredibly important work connected to air pollution, and really has been a key player when it came to things in both UK and EU air pollution research and policy, and then more recently has been working and again has been instrumental in creating the science and the connections between the science around air pollution and climate change, and taking that to an international policy context. Johan?
Yeah, I'm not sure I can live up to that introduction, but thanks, Rob. So I've essentially worked in the same job in York forever. So I've been here 35 years, and in that time working with the Stockholm Environment Institute when it was formed, and before that another sort of a research institute, the Bayer Institute, which has headquarters in Stockholm as well. And I started off as an ecologist working on acid rain when the UK and Sweden were at war with each other over the emissions and where they were going and causing ecosystem problems in Scandinavia. And so right from the beginning of my work, I was working towards the conventional long-range transboundary air pollution. So this is a UN-led agreement where the countries are all parties, and it's very interesting because there was a hardwired structure which made sure that the research was feeding straight into policy. The policymakers were asking for research, and it went up and down to feed into that process. So that was a very interesting process to cut my teeth on. And it led to a sort of continuous engagement with decision makers. So in my career, it's been quite natural to link with policymakers, and mainly I've been working with decision makers at national scales. But I then started getting involved in work to try and take some of the, because it was considered a success story fairly early on, the conventional long-range transboundary air pollution. And so it was taking some of those learnings to Asia. And there was a program called RAINS Asia where we were looking at the impact side, and other people were looking at integrated assessment and trying to engage with decision makers. And through some of the linkages there, and through a program which I helped coordinate for Swedish SIDA, the Swedish aid organization, we, with the United Nations Environment Programme, we developed an agreement between all the countries of South Asia called the Mali Declaration on the Control and Prevention of Air Pollution. and tried then to sort of build up the capacity of the governments there to address their common air pollution problems, but also the transboundary ones. And we did the same thing, working in setting up a network called the Air Pollution Information Network for Africa, which was mainly focused on Southern Africa, and trying to get collaboration between about 10 countries down there. And this was all in the 1990s and 2000s. And then CEDA pulled the money, which meant that these sort of went on the back burner, but we're in the process of trying to revive those by linking up with the ministries of those different countries. So since I moved out of Europe fairly early and working mainly in Asia, Africa, and Latin America now. And it's really supporting national governments in developing their planning on addressing their air pollution and increasing the air pollution and climate change problems. Because these things are so terribly interrelated, but they're dealt with in silos, which is one of the problems we have. But increasingly, people are seeing the importance of linking these things together. So I also have always been fairly heavily engaged with the United Nations, especially UNEP, in terms of developing assessments. And those assessments are designed to try and synthesize information for use by policymakers. One of these helped to form the Climate and Clean Air Coalition, which has now got over 70 partner countries, mainly ministries of environment, but not always, as well as a lot of NGOs and other organizations, and the intergovernmental organizations like the World Bank and other banks. So we're mainly still working, I've been working very heavily with this Climate and Clean Air Coalition, mainly trying to support national governments in their planning and trying to develop integrated climate change and air quality planning. And then that also has linked a bit to the local government to try and get some vertical integration of policy. And now we're starting to work with the private sector as well. So that's quite exciting. And we've also, in terms of the research that we've done as a group, there's integrated assessment. We use a tool, so it's tool development, and it's making sure the health impacts, which are a big driver of air pollution policy, are to the extent possible quantified, but mostly what we're doing is capacity building in those countries, so to try and get the people who are in the countries to develop the information themselves, which feeds into policy. So using some of this experience, I was for a while SEI's policy director. We're trying to sort of tease out, how does SEI, or how does the research, can it be used to influence policy, and looking at case studies and so forth. And there is a report on the SEI website which tries to synthesize learning about how a research to policy institute like SEI can be more effective. And there are other sort of things that we've been doing which can maybe come out of the panel discussion later. But I think that's enough from me.
Thanks very much, Johan. Thank you very much, everybody, all of our panelists, for sharing the work that you do, and how that has, over often many years, engaged with policy and how it's developed. I want you to, and we've heard a little bit from Paul and from Sushil, actually, of their early career, where they came into contact somehow with, in Paul's case, policy making in Malawi, and in Sushil's case, working with sort of local communities. I want to ask actually all the other panelists, if you can sort of cast your minds back, think back about what was it that sort of motivated you, or opened your eyes perhaps as an early career researcher, or early on in your career, to the and motivated you then to get involved with bringing research into a policy context. Does anybody want to sort of offer up their early career experience that motivated them to get involved with this? Please, Helen.
Hiya, I'll jump in there. I just wondered, because I started off my career not in academia at all, but working for NGOs and mainly in East Africa. And I learned a huge amount about community development and participation and importance of health in people's lives. But what I really saw was that NGOs were often doing things that were quite successful, sometimes less so. But there was no connection with policy, and it was very small scale. And even when something worked, there was no way of having impact on a beyond that community and beyond the time frame of that small project. And it was just so frustrating that I think that, from my perspective, that's what really pushed me to not only research to make sure that interventions were evidence-based and could work, but also the real need for them to lead to impact and policy change. So I think it was that those frustrations as an NGO worker that really pushed me in that direction.
Thanks, Helen. That's really interesting. Razia, excellent. I was just going to turn to you because I was interested in your story there.
Thank you, and thank you, Rob. And it's getting interesting now. So just to share my experience, when I just graduated, from a medical school, and I was a medical doctor, and I was very much interested, to learn about how this community experience and primary healthcare goes. So I decided to join a primary healthcare unit, which was quite unusual here in our context, that when you go out, as a doctor, then you prefer to go to a big hospital and not to a primary healthcare. But I was interested to join that because I wanted to know how community, primary healthcare and how community workers are doing. And so it was initially my thoughts were to do some research, that how these, because in our context, there are many lady health workers that are doing their job for the vaccination and for the antenatal coverage, for many things, in the field. They have their houses and they have to visit houses. So I was interested to know the dynamics. So I joined that, and it was a very exciting experience for me for 6 years, where when I joined, the OPD was like just 3-4 patients per day. And when I left after 6 years, it was like touching 100 people who were coming to that facility every day, which was very surprising because that community needed the medical care and the healthy environment in the community, because they wanted a leadership, so in the form of to provide these basic care to the communities. And especially from that site, I started developing a DOT center for tuberculosis, which was very rare, in our country, that a primary healthcare cannot be a TB DOT center. So it was a huge experience and exposure for me. And by that center, then there was a visit to that center, from the WHO Geneva. And then I was offered a scholarship to do master's epidemiology from London School of Hygiene. So this is how I shifted all my attentions, from the patient, from a medical, point of view to the public health. And then I pursued this epidemiology and research work after that for last 14 years. So that was a breakthrough I wanted to share.
Lovely, thank you. Thank you so much, Razia, and compliments what Helen is talking about. And again, from working on the front line and dealing with that and having an impact on patients' lives and on the care that's available to them, but then also looking to the opportunity to scale up, I think is a really interesting common thread there. Can I follow up with you, Razia, actually, and ask you a little bit about what is the reason that you're engaged with the International Union Against Tuberculosis and Lung Disease? So again, that's scaling up from national to that global level. What's the motivation of your engagement there?
Yeah, so thank you, Rob. So again, the motivation for me, that because I have a rich experience now from my country. So one thing I wanted to share my own experience with other colleagues, at the union, because the union is a platform where many researchers meet together every year, and it's a huge opportunity for us to interact with the global policymakers. So I was affiliated with the conferences initially, and then I was interested to, to get more, insight into the union work. And then this was through elections, and then I was interested to be, to apply for this vice chair position, and then that was election that went through, and I won that election. So, but I'm enjoying that because every year it's a huge conference, and then we have a lot of opportunities. And as I said, that we now have a subgroup as well on TB and multimorbidity. So this is actually exactly what we want. That is, we want to share our own experience to the global community. We want to have a broader network with the individuals who are working, in public health as researchers or as experts in the public health. And so that we can share our own experience to learn from them, and also to learn about innovations in health. Digital health is everywhere after this pandemic. So there's a lot of opportunity to learn there. So I think, and this is an excellent way to interact with the global policymakers.
Wonderful. Thank you so much, Razia. Romano, I think I saw you putting your hand up. I'd love to hear also about your sort of earlier career motivations too.
Thank you. So as I was saying earlier, that when I started teaching, I thought that I don't have the practical experience. When I started discussing with the students, I realized that unless I go to the field and understand the local context, it is very difficult to give the actual flavor of the course to the students. And then at the same time, luckily, I started working with Helen and in the Communicable Disease Health Service Delivery Program, and where from the very beginning, Helen and colleagues from Leeds, Helen was at the time in Leeds, so they focused on how to embed that the research rather than doing it parallelly in the silo. It's always important to embed that, and we took the opportunity and we developed or co-create the training program for the community healthcare providers for the rural areas, community clinic healthcare providers, and we embed that within the government existing 6 days refresher training program. And when I saw that our training program as a research component is now being used by the government, and we have been acknowledged in the government document, I really felt that this is what I want to do. And I don't want to do research on my own, rather I want to show the pathway, and I want government to take it forward and scale up nationally. Because as a researcher, I can't cover the nation through this research, but I can only generate the evidence with the support of colleagues from like Helen and other also Sushil and Razia. So through that, we make sure that the research is context specific, at the same time it's international level. So trying to bridge that also using the network with the international researchers, bringing their expertise within the country context, bringing the local through the community engagement, local expertise into that. So it is a teamwork where I feel that triggered me that how this quality product can really support government and can develop the trust and mutual equal partnership with the
Thank you so much, Romano. I fully open, of course, to other panelists to jump in on this motivation question and think about, what was it that really stimulated their interest and engagement here. But I wanted to turn actually to Paul and follow up a little bit on your observation, having spent time in Malawi, embedded, if it's the right word, as a fellow in a sort of in a civil service context, and you said that you really got an understanding of what the constraints were that they were being faced with. You explained that one of them, of course, is a budgetary. It's a resource constraint. The money isn't there. I just wonder whether you wanted to give us a little bit some other examples, if there are relevant other examples of what was the policymaking context like that you were exposed to back when you were doing that fellowship. What were there constraints? Were there enablers? What were they?
Yeah, no, thanks, Rob. So, and this really is what we do now within our program here at York with partner universities in East Africa and policymakers, Ministry of Health policymakers in particular. But if I can just bring you back to that experience, which is still a common experience in not just ministries of health, but in different ministries. The office opposite mine was the director of budget for Malawi's Ministry of Health. So he was the individual who had to sign off on all budgetary commitments. And my kind of residing memory of that time was every day somebody coming into his office, usually externally, making a compelling case for something that needed to be funded. One day it was ambulances, the next day it was scaling up any number of maternal care, the next day it was the need to build new hospitals, increase surgery. There's always always something. And he had very few individuals around him with who to support and inform him in making these vital choices which affect what is delivered within the country and what health results. But he had that kind of purview of the whole system. And it was often external organisations, aid agencies, NGOs at times, all who were passionate about their case and their cause, but not everything could fit within not just the budget, but also the capacity of the healthcare system, the managerial capacity, deliver a whole number of things. These challenges are always faced in all healthcare systems, even with much greater levels of resource. And just to kind of bring this into kind of the international fold a little bit, given the focus here on international policy making, there's still in the main part, the international organisations who are working within health or in other sectors are organised around issues or cases. So you will have the TB union as one example. In the world I work in, there's UNAIDS. I do a lot of work in HIV particularly. There's the Global Financing Facility for maternal health. And the funding at the international level also works by across issues. If we look at the Gates Foundation, which is behind a lot of funding initiatives, they don't speak the language of primary healthcare, as Razia highlighted was her passion and beginning work. They speak the language of new interventions able to tackle individual diseases. So you put these things together, there's this overwhelming pressure on systems and individuals and healthcare workers or teachers, if we're talking about education, or outreach workers in agriculture, who can't, the system and the individuals can't do everything which is asked of them. And there's this kind of disconnect, I think, if you could say, between understanding of needs locally, whether that's through NGO delivery or through national policy making, and some of the influences and pressures coming down from internationally. So I think as researchers, we can often do more to identify what can be the priorities and what's the potential gain across full populations through individual choices or individual policies being adopted. And it's such when we're discussing the needs, particularly in resource constrained settings, everything seems compelling, and it doesn't feel right that key interventions, healthcare, which should be universally available, are not. But it's my belief that it's only through taking the view of the whole system that we can really start to make inroads into some of the kind of the key needs being better met from within the constraints which prevail.
Thanks, Paul. Do you think that these global organisations, these funding initiatives, are willing to listen to those sorts of multiple pressures that you've set out as being, the reality of the front line?
I think it's a challenge and it's a journey. And what I've come to realise, the more I've kind of engaged in international policy level discussions, is that individuals and organisations are in something of a marketplace, actually, and there's a battle, if you wish, to show that their cause is the most important one. So this perpetuates this scenario, and particularly when key funders such as the Gates Foundation or if it's the UK bilateral, whatever the funding source is of these organisations, if the need to think across systems isn't identified at the funding source, we can continue having this risk. I should say, the more discussions take place across boundaries, across silos, the more common ground can be found, and we can start to move forward within a journey. But it's not easy. It takes time, and it kind of takes commitment, and everyone needing to kind of look beyond their own initial boundaries.
Thanks so much, Paul. Helen.
Thank you. I just wanted to pick up on something that Paul had said and share something that happened during the TB and tobacco study. So the whole that we've sort of alluded to, so the whole sort of aim of that project was really to integrate tobacco cessation within TB services, and that's good for TB outcomes and good for patients on a number of different levels, but doesn't happen routinely, which, you know, to many would seem like a real no-brainer that it should be, but it's really challenging. But one experience we had, sort of linking to what Paul was saying, was we pulled together different parts of WHO that were working on TB and separate parts that were working on TB, and this is on tobacco. And so this was at regional level, sort of in the EMRO office and different WHO offices. And it just became very clear in that workshop that the tobacco people and the TB people just hadn't really come together and talked and thought about ways we could actually move this issue of integration forward. And I just think that's something that maybe we don't realize often as researchers, that we can, you know, if we put those kind of activities in our funding proposals, when we put them in, you know, meetings to bring together all these actors across UN organizations or WHO, these kind of global actors, it kind of gives them an opportunity to actually look at things in a fresh way and cross those silos so that we can facilitate that to happen, actually. And I'm not saying it immediately leads to change, but it's about building those relationships, and maybe the connections that you can kind of catalyze will lead to some changes. So
Thanks so much, Helen. Over to Johan. I don't know whether you want to pick up some of those things, Johan, because I know that that's an area you've been working on, but please go ahead. And everyone else, I love raising the hands. Please do raise a hand, and I know you'd like to come in. Johan, sorry.
Yeah, so there's a couple of things. So this priority setting, I mean, when we're going in and helping, a number of countries are really right at the beginning of the, you know, their journey to try and address air pollution. And so we're really trying to sort of build their capacity in order to be that they can establish their own priorities, because there's so much to be done. And one thing we know from addressing air pollution in countries like this one, you have to address all the sources. So, you know, there's no one silver bullet to say, well, that's the obvious thing we have to do, and then we do that and it's solved. You know, it really is a process. So I think that it's, and there is a lack of capacity, but there are things that we can do to try and help this situation. And so what we're doing is to try and put the quantification of the issue into the hands of the people in the countries. So, I mean, we've been working with a number of countries in developing their nationally determined contributions. Some countries have taken on board this, you know, desire to do the analysis for themselves, so that they trust the data, they know where it's coming from, they know the assumptions that are being made, and then they can be more convincing to their decision makers about what needs to happen, and that these are sort of robust conclusions, or if they're not robust, you know, how unrobust they are, but at least they're in control of the information. Other countries are relying still on international consultants flying in, doing lots of analyses, and you know, now they're calling for updates on the climate plans every year, you know, and so those countries who don't have systems, you know, really at a big disadvantage. So I think building this capacity so that people can advise their own decision makers, and this can help with the priority setting, which Paul talked about, because it's not just in the health sector. And the other thing is silos. I mean, you know, there are silos all the way down the line. So it's quite interesting. We've tried to sort of work through UNEP, UNDP, UNESCAP, WHO, and often they don't talk to each other. And so one of the things the Climate and Clean Air Coalition has tried to do is actually all these UN agencies are part of that, and so it's that, you know, a lot of that is banging people together at the international level, so that, you know, things can be more effective in the support for countries. But then that goes down to the national level, and it's not just in developing countries. I mean, they've only just really started establishing close links between air quality and climate change in the UK, and so the NDC does talk about air quality in terms of climate commitments now, but that's taken a long time. And so these silos build up institutionally in countries. And so one of the things that we try and do when we work with countries is to link up the people responsible for air quality and the people responsible for climate change, and to try and get them to collaborate. Sometimes it's successful, sometimes the barriers are too high. But where it is successful, you know, it is a real win-win, especially since there's more money in climate change, and air quality comes out a poor second, even though it has the biggest health impacts. And many countries are more interested in their health impacts. It's just that the international community is pumping more money into climate change. So, you know, it's trying to sort of break down those silos between international organizations at the national scale, and then down at the local scale as well, you know, all the way down is so important.
Thanks so much, Yuan. And I think there's a bit of a common thread in what those last three interventions around multiple benefits also, and being able to speak to the priorities perhaps of different policymakers and see where they can be aligned. And perhaps some of the where the role of the research comes in is to give permission for these different silos to come together and find a sort of the common ground, which I think is really interesting. I saw you waving your hand, Paul. I want to give Sushil just a moment to come in, because I'm really interested actually to come back to his experience. You know, he worked for the community level, and then Sushil, you talked about then engaging at a sort of lower administrative levels, and how policy was being communicated. I wonder whether you could give us a real world example of what was working or not working in your eyes when you had that experience.
Thank you, Paul. Thank you, Rob. I think it's one thing. I think what I understood and learned in this journey is it's evidence-based policy, or engaging stakeholders, is deliberately or political in nature. When I was working as a primary healthcare provider in the remote villages of Nepal, I was merely aware how the policies are being formed. I was there to implement the policy, but without knowing how the policies are being formed. And I assume many of the primary healthcare providers or the frontline providers till date are not aware really how the policies are being set, and what influence the policy. Is this the evidence? Is this the politics? Is this the power of the relationship? And when I started working at the regional and the national level, and journey started unfolding to me, is it's basically a deliberate political process in nature. And how do we engage collectively And how do we engage not only our domains? I mean, we have, as a researcher, I mean, we create our own domain where the researchers start working and talking together. But we forget there is a large segment of society and the political and the policy entrepreneurs, I would say, not only the policymakers. I would really say the policy entrepreneurs or the policy players who are more than the policymakers. And then interconnection between these policy entrepreneurs and the policymakers and what the policy comes out at the end of the day. It was quite a fascinating journey to me. I don't say I understood fully, but I'm trying to learn about this how the influence matters. And then the word I coined here is the power into policy. The what power, and I'm not talking about the political power only here, is the community power. And then the base I started in my journey in health is the community. And I tremendously valued the community power in terms of influencing the policy. How that links to the higher level, normally I wouldn't really like to call higher or lower level, but the community influencing the policy. And I realized in my journey is a clear gap in terms of how the community can influence the policy-making process. There is a deliberate democratic inclusivity, which we often talk in paper and policies. However, the action into reality about the inclusivity of the community in the policy-making process is a very, very far line that you can draw. And we are bogged down in terms of definition. When we say, what do we mean by community? Who are the community? Who are the community representative? Who are the civil society? HIV, people working in HIV, can they represent the whole health system? Or do they only represent the HIV segment of the public health? So that sort of dilemma, we have never really come up. And I working in Nepal and a number of LMIC country contexts, we often really put the segment like, oh, this is the community who represent HIV, this is the community who represent TB, and this is the NCD, and this is mental health. I think that notion, that need to be teared off, I would say, in a very blunt way. I mean, not as a researcher really. That need to be understood in a meaningful way. Community is community. How the community can be empowered enough, or can the community connected enough to the policymaking process? So it is a deliberate political process in terms of making policies. However, the influence, views and beliefs and evidence, how the evidence can be connected to this community deliberations. That's how I feel, and my experience as a community healthcare provider, unfortunately, I see still this is missing piece in the policymaking process. Over to you, Rob.
Thank you so much, Sushil. I see Romano has her hand up. Before I hand over to you, Romano, it's been really interesting. We're talking a lot about some systemic issues and structural issues, and I don't want us to move away from that just yet, but to flag that I think it'd be really interesting for us to have some practical advice about how to go about building some of these relationships with policymakers that you talk about. So we'll come on to that soon. But before we do that, I really want us to note that these issues around ownership not only of policy but of evidence, and the ability to create that evidence is a key factor. And Johan's talked a lot about that. And we've heard about this question of inclusivity and who gets to be part of different communities and have a voice, if you like, in the decision-making context. Very interesting from Sushil there. And there's a real connection here, I think, to something that Helen mentioned earlier, which is the idea of Sushil, you talked about policy entrepreneurs, policy actors, that there are multiple players. It's not just research on the one hand and policy on the other. There are a whole other set of people, whether they are communities or whether they are NGOs or other actors who are part of this landscape. And I wanted actually to come on to a little bit about the idea of building alliances and building alliances across a number of different stakeholders in order to really maximize the influence and ability for research to inform policy. But I want to give Romano the opportunity to come in first.
Thank you. Lots of issues, so I will try to address from my experience some of these. So in Bangladesh, before 1998, we had a project-based approach. So there are around 116 projects, each had with their own program manager, implementing agency, and then government really realized that it is creating silos, and then we adopted the sector-wide approach in the country. And then we started, if I remember, 22 programs where we tried to merge some of these programs, but nutrition remained outside of the program. So that was a issue that in the next sector program, government included nutrition into the sector program. So now we are running the fourth health sector program, the sector-wide approach, but still I think the problem is that the way the health system is structured in Bangladesh is Director General of Health Services and Family Planning. So maternal child health. So there are two programs now, one under health and one under family planning with less coordination. So within the system, if these two are not coordinated from the planning and implementation, I think we will not achieve the objective. And what is that? When we develop the strategies, these are quite broad and, starting from policy, then strategy, and then actionable plan. I think there we have the gap that policy is there. This is really nice on paper. But when we talk about the implementation, we think there are weak implementation. And one of the reasons is that this bifurcated health system and also other factors and like limited capacity and the way we allocate the resources from the central to local level. As a health economist, I think I have to highlight this, that whatever we do, ultimately you have to translate this into budget and budget execution. But due to this system and bifurcation of the revenue budget, development budget, and what is operating and development, and the way of channeling these resources to the local level, I think there are still some ways to overcome the system loss. Just one point is we tried the bottom-up approach and doing the planning through the local level planning. But what happened is we formed very systematic way of in each area, there will be local level planning per year. They will identify the problems and they will channel those to the central level through some toolkit and which will identify and document all these problems. It started very well because people started giving their problems, what should be the solution, what they want. But when this document came to the central level, due to the centralized system and centralized planning and budgeting process, we could not allocate the resources to the local level as per those local level planning. So people got disappointed and they stopped doing these, engaging in these meetings. And ultimately, there is no local level planning at this stage. UNICEF tried to do some piloting, and in those areas, really we saw that the engagement of the community is really well, and the planning and allocation and plan implementation, these are far better than some other countries, some other areas of the country. So definitely the local level planning has this strength, but I think the work the NGOs are doing, if we can integrate that within the system, that will boost up the energy and create this type of bottom-up approach, because this centralized system really has its inherent problem and it's very difficult to raise a voice. Just last point is that from the gender and intersectional intersectionality angle with Helen, and we really have emphasized in our chorus project, which is on urban health, that we always find that gender in these Southeast Asia, and the voice and accountability of the women and men is sometimes not adequately addressed. So we feel that in this community engagement, we should emphasize that the women, disabled people, and women from different income groups, socioeconomic status, their representation should be in this engagement process. Otherwise, again, this will be dominated by some few, local elites, and we will lose the actual flavor of the community engagement. Thank you.
Thank you very much, Romano. I'm wondering whether anybody else wants to come in on this issue around sort of inclusivity, and also perhaps creating alliances that break down sort of existing silos or existing power structures about who is. So, Anna, Helen, please go ahead, and then you.
Yeah, I just wanted to share some I'm part of a consortium called the Arise Consortium, and they've been doing a lot of work with communities and informal settlements, and using really visual techniques like participatory video, photo voice, and to capture the issues, and that just seems to really help in terms of raising the profile of issues from different perspectives, and has just been a really powerful approach. And I know that the ARC Foundation and Herd International have also used those kinds of approaches. And I think it's finding ways to support people to have a voice that can influence is really important. I think there are some, with technology and with different approaches, there are some really interesting ways to try and do that now.
Yuan.
Yeah, I was just prompted. There's so much focus now on rapid change to do with the climate change coming out of the COP26, and this is really quite fundamental for many countries in terms of sort of rapid change and how on earth that's going to be implemented. So it seems to me that we need to get much better at trying to link the sort of global finance to the action that is actually going to be meaningful on the ground. And I get the impression that often there is a big gulf between the people with the money and the needs of different countries. And the second is just how they're going to implement many of these measures, all the way through the country. So it's like, how do you take a national target? So we were just talking to a colleague who works for the Ghana Environmental Protection Agency about the target to shift people, cooking on wood fuel to cleaner cooking. So at the moment they got about 25% of people with cleaner cooking. They want that to be 50% by 2030. And then just thinking about when in 8 years, what needs to happen, and how is that going to, is that going to be financed? And if you don't put all of these bits of the puzzle together, especially where the money is going to come from, it's very difficult to see how you can get the rapid change. So it was a very interesting discussion about the detail of that one particular measure, and there are 48 or 24 or 48 measures in their NDC. So each of those needs to have the same level of understanding, and they can't pay for it all. So there needs to be a link to international finance, and that there's a lot of bureaucracy as well, which is, and just listening to him talk about the added bureaucracy from the new changes from the UNFCCC in terms of annual reporting. Much more detailed tables. It's going to take a lot of time, and some countries just can't do it. They don't have the capacity. So he was actually trying to help Liberia fill in there or respond to some of the queries from the UN agency. So it's really tough for people in these countries, but at the same time, they are very keen also to implement things at scale rapidly. but somehow we've got to link the implementation at the local scale through to national scale through to international finance.
Thanks, Johan. Before I hand over to Paul, I just want to remind everybody on the webinar that we'd love to hear from you and to hear your questions. I'm going to keep going with this really interesting conversation for another 13 minutes or so before we turn it over to some questions from the audience. If you'd like to pose a question, please use the Q&A function and type in your question, and we'll pick those up in the Q&A starting in 12 minutes or so. Paul, over to you.
Thanks, Rob. I keep on going to change the point I intend to make based upon hearing fascinating discussion and inputs from everybody. But I'll try to come back to what I was going to highlight. And I was going to pick up from Johan, who highlighted the importance of capacity building and capability building at the national level, and it really made me think again, because we was discussing this kind of the alphabet soup of organisations who operate internationally and how to kind of navigate through them. And the point I did want to make was that international organisations derive their legitimacy from member states or local organisations, and then Sushil reminded us about the importance of community groups, and I guess kind of national level or organisation, or national level policy makers, if governance works well, derive their legitimacy from communities and who they should represent. But it just made me think about what our role as a University of York, can be within this space. And I think we've got some key strengths as a university, which are probably underexploited by all universities currently. It's often think tanks who are more at the interface of research to policy nationally and as well as internationally. And I think there are real advantages of universities making contributions which others, such as think tanks, actually don't have. One is our capacity to support capacity strengthening, so to link research to training, whether that's formal or in the form of short courses. And I think secondly is that there's our real potential to be an independent voice. Particularly if we work with university partners across the world. I think we have independence, a greater degree of independence than think tanks or others may have, which can be so vital in generating and building trust. So I'm not sure, if it's now is the time for this full discussion, but I think there's real possibility to think creatively and strategically about how we across departments as a university can draw upon our skills and advantages to strengthen research to policy in a way which meets many of the objectives which have been detailed here.
Thanks very much, Paul. Sushil.
Hi, I just really wanted to make one note that my experience has been in terms of like the guidance, how do we link with the political interest to the evidence? I mean, as a researcher, I have been generating quite a number of evidence in different areas for that health system is strengthening or the antimicrobial resistance or the urban health systems or the rural health system is strengthening. However, one thing I struggle quite a lot in terms of how do I link with the evidence that's been generated through a scientific research process to the political interest. Often in the country that I work, LMIC context, there's a political deliberation, political interest, basically. There's a power, and that power becomes a political interest in terms of dominating the policy-making processes. engaging with politicians and making really the evidence update is there in political platform to guide the policy making process and resource allocation process. That's been quite challenging, particularly when the political stability is not there, the political fragility is there, and the whole system is politicized. I mean, people are less interested to talk about evidence, but they are more influenced and attracted by the policy. And those are the policy entrepreneurs who are closely linked, and there is a great value of evidence in policymaking process. We cannot deny that. However, in real context, how the evidence is valued when the policies are born. That's really interesting and observation I had. And one thing, what we did, I mean, real example in multi-drug resistant tuberculosis, we had World TB Day, and then we presented evidence generated through the COMDIS research, along with the University of Leeds. We presented evidence to the health ministers, secretaries, and National Planning Commission chief. But it was not valued enough. Then we tried to engage where the community can brought into the main play in terms of really communicating this evidence, not as a researcher, but as the real person who is experiencing things. And then during the World TB Day, we had a stall where we brought a couple of multi-drug resistant tuberculosis, people living with MDR TB, and they agreed, they came, and they presented their real story. And we as a researcher, academician, sometimes we fail to tell the story in the right way, right? Which is understood by the politicians or the policy entrepreneurs. And in that 3 minutes, miracle happened to me in my journey, and that's my experience. Others may not have that experience. And the Prime Minister and a couple, married couple, both were infected with the MDR tuberculosis, and they were struggling to access that treatment. The quality was pathetic, that treatment, and the high expenditure on treatment. There was no support from the national government in terms of, there is no subsidies. Free treatment was not available at that point of time. We communicated that to the policy entrepreneurs, policymakers, quite a few times. We were least heard when the community actually affected, infected, and the suffered community engaged. I think what I'm trying to say here, my experience in terms of how do we communicate the evidence to policy entrepreneurs. As a researcher in the form of policy brief, which is good. As a researcher in the form of academic article, published in peer-reviewed journal, absolutely fine. But this webinar is particularly focusing on the global to the local in terms of like how the policy influence. To me, it's very important that we find appropriate ways of engaging community and the sufferers to bring their voice up front, to translate the evidence into policy, not only the policy, but in practice, how the policy, I mean, we have in my country, there are lots of policies there, best policies in the world in some of the areas, I guess, but it's not been translated into reality, into practice. So bringing this, connecting these missing dots between the researchers, policy entrepreneurs, and the community and the sufferers. How do we act in this, and how we can be a kind of interlocutor as an evidence producer, as a researcher, as an academic, is really something we have our routine domain out there, where we have pretty much framed, I guess, in some way. How do we really cross that frame and come to the reality in terms of influencing the policy at the national and international level? That experience really, to me, is very unique, and it touches my heart. When a couple MDR TV patient talked to Prime Minister when they visited our stall, we were not there. They were not researchers in their stall. Only the people who suffered from the disease, and they told their story in 2 minutes. Things changed, and there was a incentive mechanism been put in place in a week time, and there was a focus on multi-drug resistant tuberculosis in Nepal, and there was a support from the government, and there was a high recognition of multi-drug resistant issue in Nepal. To me, I mean, I'm talking in a very plain fashion, that how do we communicate to policy independents, and how do we engage or disengage with them? That's my experience. Sorry, I just wanted to make it here.
Thank you. Thank you so much, Cecile. And I've seen this as well. The power of stories and storytelling and bringing the individual experience to a policymaker can really unlock a decision. And I think that the reluctance perhaps sometimes of research to do storytelling is perhaps based on that old adage that the plural of anecdote is not data. But I think that what you're suggesting is that you need anecdote to unlock the power of data to then be used to design the sorts of policies that can really make a big difference. So thank you for sharing that. I think
just wanted to say one thing. I mean, we have, as an academic, sometimes we feel that when is the appropriate time to reveal the report, that our research report, because there is an academic journal awaiting to be published. I think something needs to be changed here. There are right opportunities and right time to influence the policy at the local level and the regional level and the global level. You should really tap those opportunities by engaging not only you. Don't hesitate to put your research finding, if it is not the academic journal or the high-rated peer-reviewed journal. You need to come. I link that process with the policy making. And it's really when the fast-changing political scenario like Nepal, maybe Romano will agree with me, in Bangladesh and in Pakistan, Rajia will also agree with me. So we have fast-changing political processes rapidly changing, and we should not wait something to be published and then communicate. We should really take this opportunity to really grab and link with the policymaking process with the evidence. That becomes much more stronger base rather than just sometimes we think more academically than being practical. Sorry, I just
thank you, Sushil. Yuan, please.
I was just going to build on a couple of the issues there. So with all of this work with either national governments or even communities, that the issue of trust is really important. And in terms of being able to put forward evidence at the right time is also key. And for both of these, you need to have long-term engagement with either the communities, the local authorities, or the national authorities. And then you can find out when the timing is right that the evidence is needed. Also, just the trust in wanting to work with you and finding out what their needs are. So, I mean, a lot of our research has been, influenced by, you know, the requests that countries for evidence which they believe will unlock decision making, you know, and you only get that when you get to know people. But of course, it's rather difficult with the sources of funding and so forth that either universities or institutes like SEI have to maintain long-term relationships, because, you know, sort of it takes time, you know. But if it's very difficult to see how we can be effective at helping countries or communities without spending that time to get to know people personally, what their issues are and how we can contribute.
Thank you, Yuan. I'm going to turn now to some of the questions that have been submitted in advance and that are coming in the Q&A. And just to let everybody know on the webinar that the Q&A is still open. Feel free to add questions to that Q&A. And I actually have a question both pre-submitted in advance and also in the Q&A that's quite similar. It's from Santos Giri. The question is around community engagement and a feeling of making sure that community engagement doesn't amount just to tokenism, but is actually something that can affect the deliberations around policy and affect the sorts of evidence that is also taken into account. And here we also had a similar question here around what are the leading players doing to ensure that multiple paths are heard, discussed and addressed when developing policy, so that process is not just a continuation of the status quo. Is weight actually given to the views and voices that go against the grain? So here a question of making sure that a question on inclusivity, and also making sure that there's a pathway to challenge perhaps the status quo. If anybody on the panel has experience of this, about how it happens and how to make sure we go beyond tokenism, I'd be really interested to hear it.
Can I just jump in? Yeah, thank you. So it's really important that community is empowered and they can identify their problems and they can also come up with the solutions, which is context specific, as I was mentioning earlier. But in a country like Bangladesh, where the literacy rate is still not up to the mark, and where there is still gender inequity within the system, and also some other cultural and religious barriers in the country especially for the women to come up and raise their voice. And even it is not in the community, it's in the household level also. So women coming in the decision-making process, unless they have also financial empowerment, it is very difficult. But as we are progressing and we can see that the women are absorbed in the labor market, they have a more financial autonomy, which gives them the power to raise their voice and contribute in the decision-making process at the household level. And then they're coming out and contributing in the overall, community engagement for the policy making also. So with the development of the country literacy rate and other macro level indicators, as we progress, something are, coming together. But at the same time, they need a more orientation, that how these voice can collectively create a pressure on the system, so that accountability is ensured in the so that needs some investment from the government, development partners, civil society organizations. And just I wanted to give the example of the community clinic project in Bangladesh. So one community clinic has been built for 6,000 population, and each community clinic has one community group and 3 community support group, and each group has 17 members. So at the initial stage, they did not know that what to do and how to contribute in the system and how to raise their voice, even having this, these format in the country. Then governments realized that, and then they encourage NGOs to divide the area and work in different areas and build the capacity of the community so that they can contribute meaningfully. At the same time, government also channel resources to do the orientation of this community group members, so that they can come together, and they can also elect members and then form their committee and then also raise their voice and integrate within the system. So it needs lots of investment, engagement, and also leadership. And I think at the central level also, with the change in the policymakers and with the change in the also the staff in the system. So new people come in and then they also need orientation. So it is an iterative process. So it is not only the orientation at the committee level, but at the central level also, having the capacity to use this information and use this in the policy making process needs also capacity development at the central level. Thank you.
Thank you, Romano. A great set of things that need to be done. Sushil and then Helen, please.
I just want to say that politics, for better or worse, I don't know, but plays a critical role in making policy affairs, policy decisions. Then it's important that it's central, very central, to understand how the agenda setting takes place. Who are the players brought in play in agenda setting process, and the capacity of the community to be able to participate in this agenda setting? That's very, very important. Based on our experience in Nepal, we often call community people to participate in a number of events, either in the name of civil society or the affected, infected communities. But without empowering them, we invite their participation. And there's a great deal of empowerment need to go into play for them to contribute to the agenda setting process in the policy making. And in absence of that, and that is what I really want to distinguish, the tokenism and the meaningful participation. And the meaningful participation can only happen once we empower the community to be able to raise their voice in an effective manner to the agenda setting process. And there are lots of ideas. They need to be shaped in a very coherent fashion, to me. That's what we understood in our experience in one of the urban health projects that we did in Nepal, that we reached out to the urban poor community in one of the major cities in Nepal. And we asked, constitutionally in Nepal, basic healthcare services, that is a package, is a fundamental right of people. But people were not aware about their rights, what the basic healthcare service package is, although it was defined by the federal government, but they were not empowered enough to understand what their right, what their entitlement it is. And without knowing their entitlement, bringing the community in a nice forum where well-dressed people are there to talk about things, and community gets really disempowered in that process. So they cannot raise their health needs without understanding what they are entitled to. I think it's a first and foremost process. If you really want to bridge the gap between the community participation, tokenism, and the meaningful engagement, then you should have a process of empowering community, the community engagement process first. Then the evidence that we have is, during our course of work over the years, is how this community interact themselves internally. In the name of civil society, I think we need to bear in mind that there are a number of different civil societies been formed who are willing to participate. There is a elite capture, which perhaps need to understand more effectively in the context of Nepal, where we have lots of rural places where the people are not really empowered enough to understand their rights and tailor their rights to the decision-making process. So there is an elite capture. And then how do we really engage in that process to influence the views and the beliefs of the community that are really suffering, that are marginalized? The powerful constitution in the world, I guess, in Nepal, under the federalized context, it's really right, it's been well secured, but exercising that right through the greater acknowledgement and empowerment of the community and the thing I spoke earlier about the inclusivity. There is structural differences in terms of bringing these people to the agenda setting process in the policy making. There are structural bias, and how do we really overcome this bias is get engaged community more, empower community more, and stand with community more. And there's three things I learned in my journey, really. It's engage community more, empower community more, stand with community more in terms of agenda setting process. Otherwise, lip services will not make the difference in terms of reaching out to the vulnerable communities. Over to you, Rob.
Thank you very much, Sushil, for embroidering on what we heard from Romano about the need also to be engaging over a long term with communities, not only in policy making, but also implementation. And you've extended that into a broader set of agenda setting and understanding their rights and entitlements to empower them and then really stand with them over time. Helen, please take us further on this.
I just wanted to share some experience of some work with the organization in India called the Urban Health Resource Center. So they had a really interesting approach. So WHO have a whole set of indicators called Urban Heart, which is all about looking across different sectors. So, I don't know, transport, health, education, to try and assess the extent of urban development. And they rely on all sorts of large data sets that, are quite hard to come together. So basically what UHRC did was take those indicators and share them with women's organizations based in slums in Delhi and one other city, I forget, in India. And they sort of developed their own way of assessing and monitoring those indicators in their communities to identify areas of need. And then they had some very specific requests to take to local government. But they then also, so I guess that was a very practical way of kind of empowering them to look at the different issues and then take those to local government. But then they also had a set of indicators where they could see, well, has anything actually changed, and what's changed and what's improved, and then more advocacy when those gaps were still seen. So I just thought that was a really nice process of actually kind of making very real and practical these issues around empowerment for change at community level. Which is really interesting to see.
Thank you so much, Helen, for that example. It really brings to life the topics we've been talking about. Like there are sort of three questions that I'd really like us to get to before we wrap things up. One of the questions is a brilliant one that's been submitted by Rob Marchand, and the question is this. Some would say there is no shortage of policy. It is implementation and enforcement that are the real challenges. Should there be more focus on implementation and enforcement rather than policy development? And what's the role of researchers such as yourselves in moving from the policy to that implementation and enforcement? Who would like to take a bite at that question? Johan, excellent. Please go ahead.
Well, I mean, this is somewhat context specific, so I'm going to talk about the context that's facing countries at the moment. So the policies around, greenhouse gas mitigation, air pollution, that sort of thing, is a sort of rapidly developing field. And there's the question in all countries, not just developing countries, but any country, about whether those pledges, plans, targets are going to be achieved by action on the ground. But it seems to me that the policy development and the implementation needs to be sort of developed together. So there needs to be a very clear idea whilst developing the policy, how it's going to be implemented and what's required for that implementation in great detail. And then, identifying the barriers that need to be overcome, financial and other, and have a way of going, trying to overcome those. And if they can't be overcome, if the barriers are too great, then, well, that's difficult. But it does seem that, certainly in the case of these national plans that are being developed, there's a lot of targets. We looked at one country's, they had an implementation plan for every measure, but it was only 2 sides of A4. So, that needs to be expanded by about 20 to put down all of the actions and things that need to happen. So there's a lot of work to be done, but hopefully that is, so I think we need to spend much more time on that implementation piece, not just sort of be satisfied that, oh, great, there's a policy now.
Thanks, Johan. Can I follow up a little bit? I mean, you actually also already talked about the importance of capacity and finance, actually, as well as to ensure you get to implementation. So I think that those are 2 other key factors that need to be borne in mind. But can I ask whether you think that when it comes to implementation, you're looking at we've talked about the need to perhaps not break down silos, but certainly connect up different silos in policy and decision making. But when it comes to implementation, do we actually need to empower a silo, a ministry, to make sure that they're the ones actually that are accountable for delivery? Because otherwise there may be a sort of, well, after you, or I thought it was them who had responsibility. Or another alternative would be, do we just really need to go and make sure that ministries of finance put the money on the table?
Well, often we're working with the Ministry of Environment, which is probably the weakest ministry in government, usually. But they're the ones who are kind of activists within government who are trying to promote the change. But the only way that they can operate is by working closely with other ministries who are actually responsible for the implementation. And that's been part of the work we've been doing. So the Ministry of Environment convene with the ministries of transport or energy, the people who actually got to do the work on the ground, and make sure that there's buy-in there. Now, the Ministry of Finance is vital in these discussions, as is the ministry responsible for national planning. So this is all about development. So it needs to link to these powerful ministries, and it's quite difficult to get their attention because everyone's knocking at their door. And one of the things in terms of the research that can help this is this sort of multiple benefits approach. If you can stack up all of the good reasons why money should be spent on something, and you have the information, or the decision makers have the information at their fingertips to convince the Ministry of Finance that it's worth financing that's important. So, for example, in Ghana, this colleague from the Ghana EPA said that, if he goes and talks to his minister about CO2 emission reductions, they're not particularly interested because, well, we're a small country, it doesn't make much difference what we do. But if I go and talk to them about health impacts and the health benefits of taking action, then I get a seat at the table with the Ministry of Finance. It may be a very long table, but at least I'm sat there. So without those sort of like key development outcomes, you know, quantified if possible, you know, to make the point that this is worth investing in, then it's very difficult to make any progress.
Thanks, Johan. Helen.
Sorry. Yeah, I wanted to share some experience of, we recently conducted an evaluation of a program to support the Framework Convention of Tobacco Control's implementation in 15 low and middle income countries. And the insights from that evaluation were just really eye-opening. I mean, first of all, the fact that there is a framework convention on tobacco control, the fact that it is kind of driven by this really clear little mnemonic of empower, which is monitor, protect, offer, warn, enforce, and raise taxes on tobacco. So it's got really clear areas that governments should be working on. So just seeing how that had been implemented in different contexts and what had worked, and where things seem to be, you know, where countries were making the most progress, it's when they had Ministry of Finance on board. It's where they had those kind of cross-ministry engagements. So, for example, in Southern Africa, the Ministry of Agriculture and tobacco growers linking with Ministry of Health and Ministry of Finance. And obviously also with tobacco, you've got this added thing of industry interference that they've all got to try to, they're up against and trying to react to. So, and also the other factor was having civil society pushing and checking, you know, what's actually happening. And it was kind of all those levels, along with some real champions, whether they were parliamentarians or key academics or civil society people, really pushing the agenda. So yeah, just I think there's some really interesting lessons from the Framework Convention on Tobacco Control, and just having that clarity that everybody is trying to follow the same framework, and it brings people together to assess, keep monitoring progress and come together at different aspects. So I just think that's a really interesting example, and possibly one that could be really useful in some of the environmental issues, but some of the other aspects that we're working on around urban health, for example.
Thanks, Helen. Really interesting example. Empower. I've got it in my brain already, and you only said it once. So that was brilliant. Paul, I'm going to give you the floor, but I would really like you to answer an additional question in this. And I'm very grateful, and you generously have written an answer to one of our questions here. But I think that I'm really curious to hear your take on what the challenges are and what the techniques that you've used when you are being the thorn in the side, when you're perhaps more of a critique of policy rather than perhaps, you know, seeking to say, well, here's some evidence that will help you build a policy. And I think that's really a really interesting perspective. How do you go about speaking truth to power in that case? But over to you, Paul.
Great. Thanks for putting me on the spot there a little bit, but I was kind of prepared, and I'll try to answer in a way which also stays on this topic of implementation. So I think the most immediate response to the question is too little emphasis put on implementation. I'd say yes, it absolutely is, because it's through implementation that benefit derives. And I was, before I get into the thorn in the side, I just wanted to make one quick point about our role as researchers. Often we're obsessed by RCTs, by evidence of relative effect and relative benefit, without that. I think it was Johan has mentioned a few times the phrase quantification of benefits. Sometimes that's in multiple domains as well. I think there's a real thought required by researchers in terms of how we can do more to quantify the benefit and move beyond just measures of relative effects only. In terms of being a thorn in the side and maybe saying something that policymakers don't want to hear, this takes us back to the topic of priority setting, really. and this, not too many policies in respect of Rob's question. The example here within my field, but I'm sure it's been met by all the panelists, is that there's often a desire for additional new policies, new interventions, and that has, at the international level, has been backed by organisations who find a role for themselves in championing a cause. So there's an unmet need. An RCT shows something is of benefit. It should be implemented at full scale. And you find a scenario where there's a number of approaches, whatever field you're in, which are delivered to some degree, but they're not delivered anywhere near universality. There's the phrase I've heard is, I'm not sure it's the best phrase, but islands of paradise in oceans of misery, which is a phrase an African colleague once said. And this is the question of implementation. Within our area, what did we need to do? We needed to highlight the consequences of adopting and committing funds to novel HIV interventions, where some of the most basic needs in terms of retaining patients in care were not being met, even though the quantification of benefit would be much greater. So how do you go about doing that from, and this is only based upon kind of personal experience, is not the right answer necessarily. I think you need a little bit of approach of being a friend and an ally, a confidant, having an approach of quiet diplomacy, saying things behind the scenes, but at the same time, making it clear and evident that you've got the research and the evidence to show that the policy decisions are wrong and there are greater harms than goods. And if you hold that, but you use that in a way which you apply through partnership and dialogue, I think that's the way to go. You could be too problematic, too troublesome, in which you're kind of be cast into the shadows, or if you were too close without that, too much of a friend. If you're not contributing to that level of discomfort amongst policymakers, you're unlikely to make much progress as well. So it's a little bit of a middle ground.
Thanks so much, Paul. I think that was actually a really great way to finish off a sort of a guidance on how to be both a thorn in the side, but also a useful ally, and making sure that that evidence can really be used, applied, and implemented. And with that, I'm going to hand over to Jane. Well, first of all, I'm going to say thank you very much to these panelists. Absolutely fascinating conversation. I could have kept going for ages. I have lots of extra questions, but I'm really grateful. Thank you so much. And I'll hand over to Jane to wrap us up.
Hi, Rob. I think I'll wrap us up. Just say a huge thank you to you, Rob, for chairing this, and to all our panelists for participating. It's been an incredibly lively discussion, and I found it really insightful and thought-provoking, and particularly around the themes of the need to engage at all levels, from the community level right up to international policymakers, and breaking down silos and bringing everybody together is key. And I particularly like that discussion around implementation. It's like it's a bit of a discussion we had on the SEI Away Day recently. It was like, okay, we engage with policymakers. Can we do more to make sure these policies are implemented and working on the ground? So that's particularly interesting. We have tried to cover all the questions, either directly or as part of the wider discussion that we had. We did have a lot of pre-submitted questions, so I hope your questions have been answered. The Innovation to Impact is an ongoing event series, so there will be some more events next year. Please keep an eye on the web pages for any announcements. I think the recording will be available to those registered for the events. And just leaves me to say thanks once again for a great session, and goodbye.